The fellowship brings together people from across the aisle.
What stood out to me the most was the amount of bipartisanship.
The experience that most stood out to me from this fellowship was our all-day workshop when we worked on the iceberg model. It was the first time I was exposed to systems thinking, and that was very exciting and a different way to look at health policy.
We had two experts join us to talk about the Medicare Modernization Act, and I think that conversation really shaped the way that I view health policy.
The health policy knowledge that I've learned from this fellowship was through a dinner with Dr. Janet Woodcock. She said, ultimately, what we want to look at is how to simplify where we can. So much health policy can be overly convoluted and complex. The level of expertise and willingness with which the experts came to us, they have decades of experience, have pushed forward health policies that have impacted millions of Americans. And the fact that they were so excited and willing to speak to us made me feel so seen and excited as well to talk about health policy.
And one of the things I really like about this bipartisan fellowship program is it provides not only context and knowledge about healthcare issues, but also provide skills for the fellows to learn how to become leaders in the field.
We included different elements of this program that invested in their health policy leadership, from developing and investing in public speaking skills to connecting them directly with experts where they could ask their most burning questions and build those relationships that they need to be successful in their roles.
The sessions that we had were a foray into a deeper understanding of specific bills and policies that impact us, which is atypical from what Hill staffers typically are exposed to in high-level briefings.
What surprised me most, I would say how much of going into a staffer is about your relationships and how much goes into it that is about you working with other people and creatively problem solving and making everybody happy.
Professional development can be so lacking on Capitol Hill. These are critical positions that are influencing health policy for hundreds of millions of people in the US. The fellows are talking to each other, not just in the fellowship kind of hallways, but in their formal roles, talking about ways to partner on legislation, trying to find ways that they can work together across partisan lines, across houses of Congress.
Over the course of these 10 months, I've seen how they've been able to ask better questions, to connect with each other in more authentic ways, and to show up in their roles with more curiosity, more knowledge, and more skills that can help them in their day-to-day work.
The best bills are those written by both parties.
In order for us to have the healthcare system that patients deserve, we need to work together across the aisle. And this kind of program helps people develop relationships and learn more about how they can work together to advance better policies in the future.
We're already hearing, though, that fellows are making great strides in their careers. So we've heard that fellows have received promotions, feedback from fellows, their mentors, their colleagues, that they are more confident in their roles, in their foundation in health policy, and really becoming go-to resources for their own colleagues and fellow staff.
If a colleague asks me and they're considering applying next year, which a couple of people have already, I tell them just get ready. Like, this is going to be an amazing experience, and the person you're going to be after this experience is exactly who you want to be.